Day of surgery. We suggest preparing for your hospital stay by packing for your visit a few days ahead of time. This gives you time to remember the items you may have forgotten and then include them. Things to bring with you to the hospital include your driver's license or photo ID, an insurance card, current list of medications and supplements noting when they've been stopped for surgery and which you took the morning of surgery, loose pajamas or nightgown, undergarments, loose shorts or jogging or sweatpants, and comfortable short-sleeved tops. If you are receiving a total shoulder replacement, it's recommended that you have a button-up or zip-up shirt to easily get dressed into following your surgery. Our occupational therapy staff will assist you in learning the correct way to put on and take off your clothing. Slippers with backs and rubberized soles or sneakers, toiletries, toothpaste, toothbrush, denture cleaner, cup, comb, brush, deodorant. If applicable, eyeglasses and hearing aids, CPAP and BiPAP machine. We have distilled water. Copy of advance directives, living will, healthcare power of attorney if you've made one, walker. If you already have a walker or will be borrowing one, please bring it with you so our therapists can assess it and adjust it if needed. A good book or other activities to occupy your downtime. Do not bring your own medication unless specifically instructed by the pre-anesthesia nurse. Do not bring valuables, jewelry, checks, cash, etc. We are not responsible for lost or stolen items. You are all packed and your surgery day has finally arrived. On the morning of surgery, you will shower with the antibacterial soap before leaving home. Take only those medications you were specifically instructed to take by the pre-anesthesia nurse, with small sips of water only. If ordered, drink your pre-surgery drink at the specified time. Arrive to the hospital at your instructed arrival time. This is generally around 2 hours before your surgery start time and will be given to you by the surgeon's office and/or the pre-anesthesia nurse. Once you arrive at the hospital and check in, you will be taken to the pre-op holding area. There, a nurse will get you prepared for surgery by having you change into a hospital gown, starting an IV, and reviewing pertinent health history, when you last ate, and the last dosages of medications taken. Once you are prepped, a family member or visitor is allowed into the prep area with you. During this time, you will also meet additional members of your surgical team, such as the anesthesiology staff and your operating room nurse. The anesthesiologist will review the benefits and possible side effects of anesthesia with you and obtain consent. You will also meet with your orthopedic surgeon to discuss your surgery consent. This is your opportunity to ask any last-minute questions. Your surgeon will also perform a timeout procedure. Everyone in the room, yourself included, will confirm the correct surgery site and side, and your surgeon will use a special skin marker to mark the site. You may be asked your surgery site and side several times after you arrive to the hospital. This is to ensure your safety, as it is our top priority. Your surgeon and anesthesiologist may also administer a nerve block prior to surgery to assist with pain management. Nerve blocks usually last anywhere from 12 to 24 hours after surgery before gradually wearing off. During surgery, your surgeon may also administer an intra-articular injection directly into your joint space. This injection contains a combination of long-acting medications determined by your surgeon, such as anti-inflammatories, narcotics, and/or anesthetics, and it helps provide longer-lasting pain relief to the surgical site. It is important to keep monitoring your pain and treat it appropriately for when the nerve block and joint injection medications start to wear off. Communicate any pain to your nurse so we can help manage your pain to a tolerable level. Joint replacement surgery typically lasts 1 to 2 hours. Your loved ones will be updated by surgical staff on the progress of your surgery. When you check in, please provide one phone number that we can use to communicate updates as you progress through surgery and recovery. When surgery is completed, the surgeon will update your family. You will be transferred to the recovery room, where you will be closely monitored until you are more awake from the anesthesia. Your vital signs will be monitored frequently. You will have intravenous fluids running and begin ice chips or clear liquids as tolerated. You may have oxygen during this time as well until you're more awake and able to start breathing exercises. Your surgical dressing and ice pack will be in place. You will remain in the recovery unit for about an hour or possibly longer. Then you will be transferred to your next level of care, where your family will be allowed to join you. If you are discharging home on the day of your surgery, you may stay in the surgery department until you're ready to go home. All members of our orthopedic staff responsible for your safe discharge will come to you and work with you until you're ready to go home. If you stay overnight, you'll be transferred to our orthopedic unit, where you will stay in a private room and be cared for by our orthopedic staff. As part of our enhanced surgical recovery program, one of your main day of surgery goals will be getting out of bed with physical therapy or nursing to assist you. It is important to remember to always call and wait for assistance before getting up. Our staff is here to assist you and prevent you from falling onto your new joint. Other main day of surgery goals in our ESR program include advancing your diet, emptying your bladder successfully, and managing your pain. Being up to the chair for meals is also preferred. Once you reach these goals, you will be ready to safely discharge home. We'll talk in more detail about discharge criteria in one of our next segments.